Hello, everybody, and welcome. This program is being brought to you by Northern Westchester Hospital's Cancer Treatment and Wellness Center, and we thank all of you for joining us today. We're going to have an interactive panel with a variety of panelists. We've got doctors, clinicians, a patient, community resources, a nutritionist, an acupuncturist. And what we're going to do is I have some questions for each one of the women that are on the panel today, but also we encourage you to post your questions and we will have them answered at the end. At any time during this entire panel, which should last about an hour until 6 o'clock, please private message us using the chat filter with your contact information. One of our patient navigators will contact you for assistance to help you answer the question or book your appointment. And if you're watching this presentation on an iPhone and not on a laptop or a bigger screen, you can swipe to the left to see all of the panelists. Our referral line at Northern Westchester Hospital is 914-666-1625. That's 914-666-1625. And if you're watching this, you can see on the upper left panel in bright hot pink, schedule your mammogram today. nwhgetyourmammo.org has the telephone number right in front of you. And you should schedule your mammogram, and you should know that Saturday hours are also available. Also, thank you for participating today. One lucky viewer is going to win a hydro facial from Northern Westchester Hospital's Medi Spa, located in the Chappaqua Crossing section. And the lucky winner of the facial will be contacted tomorrow. So we're going to get started. I want to introduce you first to our two physicians here with us today, Dr. Ranjana Chatterjee, a board-certified breast surgeon, Director of Quality for the Breast Program, and the Associate Director of the Breast Fellowship Program at Northern Westchester Hospital. Sitting with her is Dr. Julia Schaefer-Cotillo, who specializes in hematology oncology and has a clinical focus on medical oncology, hematology, and internal medicine. All of which to say is we're talking about cancer, blood work, internal medicine. Good morning, ladies. Good morning. Good afternoon. That's where we are already. Hello, doctors. How are you today?
Good, thanks. How are you? Thank you.
Good. So Dr. Chatterjee, I'm going to launch, okay? What are the current screening recommendations and options for breast health right now?
So right now, it's important for every woman to kind of take into account their individual risk of breast cancer. And that's something that we do as breast surgeons when women are referred to our office. We have computer programs that help us analyze what each patient's risk is of getting breast cancer. And then we make recommendations based on their risk. Overall, to just generalize for people, typically at age 40 is when you start a screening mammogram, or 10 years before the first affected person in your family who had breast cancer, first or second degree family member. So that's kind of in general terms, but we kind of go very specifically to the patient's individual family history and risk factors and figure out what their screening would be, mammogram, mammogram ultrasound, or mammogram ultrasound and MRI.
Is it safe to come to Northern Westchester Hospital right now for breast cancer screening and mammogram, given all of the talk around COVID and what we've all been through as a community?
Yes, it is very safe. We've taken lots of measures to be safe, even during the COVID pandemic, March, April, May, June, and today. So we've been here the whole time working. There have been several task forces in place, lots of committees with people constantly looking at what the current recommendations are, either from the governor or the CDC and or both, in terms of stratifying which patients need surgery and when, and making sure it's a safe environment for everybody to come to.
And are there protocols in place for COVID? And specifically, what would a patient encounter at the hospital now going through COVID screening that may have been not true prior to COVID?
So yes, and that's always changing, but right now, patients are being pre-screened before their appointment. So if anyone is symptomatic, they aren't coming, they're being asked to not come in. And just so everybody knows, the staff is also doing screening. So every day we have to fill out a questionnaire and say if we have symptoms, if we've been around anyone who's tested positive. So even the staff is being tested, but patients are also being pre-screened a day before their appointments. And when they come in, we actually have thermometers that are up on the ceiling. So when anyone enters the hospital, any of the entrances, their temperature is being screened by a machine. And that's how we're figuring out who can come in or not.
Wow, it's a whole new level of Big Brother, Big Hospital watching you. Holy cow.
Being completely wiped down, even to the hanger that's hanging on the back of the door for clothes. And we're just wiping every surface down. And patients, if they come in with a mask they're wearing from home, then they're asked to put on a surgical mask that the hospital's provided. So that's something else to expect. And visitors are also being screened. We have very strict visiting hours. So we're trying to just keep the risk down for everybody and screen to be safe.
Thank you, Dr. Chatterjee. Another couple of questions for you. What are the risk factors that increase your own chance of getting breast cancer? And do you know what we can do to lower our risk of getting breast cancer?
So this is a common question that comes up all the time. You know, why did I get a breast cancer? And typically, we'll talk a little bit about genetic testing later, but most of the time, that's a very small percentage of the population where people have a genetic mutation that's putting them at risk for getting breast cancer. So a lot of the time is we just don't know why people get breast cancer. But we look to see if there's a genetic mutation. There's also data out there to show women who are overweight or increased body mass index can lead to an increased risk of getting breast cancer. I also counsel women. The American Cancer Society recommends 150 minutes a week of low to moderate exercise or 75 minutes a week of high intensity exercise to help reduce the risk of breast cancer, and also limiting red meat and alcohol to about 3 times a week. And pork is considered a red meat. So that's something that comes up a lot. And knowing your vitamin D level can be helpful. There have been several studies that have linked a normal vitamin D level with helping prevent breast cancer. And that's something to monitor. It's good for our bone density. And there's studies now with immune system and COVID and vitamin D levels. So that's another one to keep an eye on. And stress management is very important. So often I see people who have gone through a very personal, stressful experience in the year leading up to their breast cancer diagnosis. So it's hard to correlate, but I often see stress leading to some bad health outcomes, which is why we're excited about our integrative medicine program.
Oh, yeah. It's the mind-body connection. Can't underestimate the mind-body connection, for sure. Dr. Chatterjee, if you potentially have breast cancer, if some of these screenings have indicated that you need to go further, what are the steps that you take as a professional to diagnose, to confirm a diagnosis of breast cancer?
So the first most common one is a mammogram. So let's say we feel a lump, the patient would be sent for a mammogram and ultrasound, and then they're given, then they could get a biopsy of the mass. And then sometimes we also include MRI. Some cancers aren't seen on mammogram, some are not seen on ultrasound, some are only seen on MRI. So we typically use a combination of the 3 modalities to get a tissue diagnosis, and that's really the number one way to diagnose the breast cancers by a tissue diagnosis. And the pathologist is looking at the tissue under the microscope and can tell us exactly the type of cancer and what the hormonal receptors are. And then that helps us dictate the treatment. So we have very individualized treatment plans for the specific cancer.
Thank you. Thank you, Dr. Chatterjee.
Welcome.
Dr. Schaefer-Cotillo, you're the medical oncologist. So when deciding on a breast cancer treatment plan, what are the most important factors or options to consider?
Thank you, Lisa. So I think when a woman hears the diagnosis and initially finds out about the breast cancer, it can be one of the most traumatizing moments. And for most women, it is the most traumatizing and disturbing moment in their life. And I think they really need to surround themselves with good, positive people, both in their personal life and also to find a team of medical professionals that are really going to provide nurturing care and that the patient can trust and can really ask the questions that they need answered So finding a good team of medical professionals, including doctors, is very, very important. And typically the first person that the patient interacts with is usually the surgeon. So as Dr. Chatterjee mentioned, you get a biopsy, from a mammogram, and typically the patient is referred to a surgeon. And I can't underestimate the importance of that first step, because you really want to get a breast trained, fellowship trained surgeon. It's very important that you get someone who really specializes in breast cancer, because when you're talking about a breast surgery, you're not just talking about removing the tumor. There are many different considerations and complexities to the care of the breast. And for example, the breast surgeon, if they specialize in breast care, will know that certain types of breast cancer need treatment ahead of time. So may need chemotherapy prior to the surgery. And especially if a woman has a large cancer, this could be the difference between needing a mastectomy and needing a lumpectomy. So it can really directly affect patient care. And here at Northwell, we have excellent surgeons like Dr. Chatterjee, who are really experts in this and really coordinating the care. And for example, the breast surgeon will refer the patient potentially to plastic surgery. Again, the woman may not know that this is something that's commonly done, but the breast surgeon is the one that will organize this sort of referral pattern. So it's very important to have a good breast surgeon as part of this team. And I think probably the third consideration is location, right? So I think a lot of patients, their immediate reaction might be, well, I need to go to New York City. And I think that's changing, because right here at Northwell, in your backyard in Westchester, New York, we have this wonderful cancer center where we have these multidisciplinary physicians that can work together as a team to come up with a great plan for breast cancer. And it really takes a lot of stress off the patient to not have to travel so far to the city and worry about parking, worry about the train, and especially exposures to other people and COVID and things like that. You're really able to come to a place which is close by. And also, not to mention, things happen during treatments. So you're close by if something does happen, and you're able to get the care that you need in a timely fashion.
And so, Dr. Schaefer-Cotillo, if you are the patient, what are the questions that the patient should be asking the doctor?
Okay, excellent question. So I think the first question is, well, how advanced is this? How big is the tumor? Does there appear to be any lymph nodes involved? And sometimes, the surgeon will have to tell the patient, we need more information, we may need more imaging. And I think that's another question. Do I need an MRI? Do I need additional testing to help determine what the stage of my cancer is? Another important aspect of the initial kind of plan and questions that the patient should ask is what type of breast cancer this is. Because depending on the type of breast cancer, it can really directly affect the management. And as I was saying before, if a woman has a triple negative breast cancer or HER2 positive breast cancer, this may directly affect her care and her need to see other health professionals. And again, the patient should ask, do I need to see a medical oncologist right now? Because, it may be important to do that, to have that discussion. Should I be doing my chemotherapy or a specific targeted therapy prior to getting surgery? Because not only, might that affect the surgery plan, but it may affect the overall plan for the patient. And then, do I need to see a genetic counselor?
Right.
Again, that may affect the overall plan for the patient. And do I need to do anything different in terms of my diet or exercise and some of the prevention things that Dr. Chatterjee has already talked about. In this case, once the diagnosis has been made, it's to keep the patient healthy. So I think, these are sort of some of the important things that they should definitely ask when they're initially diagnosed.
Well, it's a good segue to the question about a team approach and Northern Westchester Hospital. So who assembles the team? Let's say you're a patient, you know, you're going to your radiologist for your yearly mammogram. You get the call, oh, we see something alarming. So then you're scared, right? And when people are scared, it's hard to know where to turn. Who do you call first? And then if you're at Northern Westchester Hospital, who is helping the patient assemble the team?
Right. So, you know, we have an excellent team approach here. We all work very, very well together. And I think when the initial diagnosis is made, usually there's a referral to a surgeon, and the patient, you know, can definitely very easily see the breast surgeon in a very timely manner. And there are some times where the patient may see more than one physician on the same day. So there are many times that Dr. Chatterjee and I will see the patient the same day.
Okay.
So we can arrange for that to happen. And even if we don't, we can make it happen in a very quick fashion. We're always in contact with each other. We have a patient navigator, and we oftentimes will use her expertise to help set up tests and to help review cases, and to get them into the appropriate people, like to get them into reconstructive surgeons, to get them into medical oncologists. So
see.
it's very seamless. You know, the transition is very seamless in terms of forming the team. And none of us work in a bubble. So we all work together. And, you know, you used to only be able to find this kind of care in the city. Now you can find it here. And we all work with each other very well. We're right down the hall from each other. We present cases very routinely for tumor board every week. We discuss this on a regular basis. We discuss the patients together. All the different specialties are together, including breast surgery, oncology, and radiation oncology. We also have tumor boards where we involve the rest of the bigger Northwell network, which includes, you know, Long Island and New York City. So you're really getting multiple opinions at the same time. So even though your doctors might be here, you know, it's a network within a bigger network. And I think we all work really well together in terms of working as a team for the patient. And along those lines, you know, it's not just the medical professionals, it's all the supportive care that you get here. And that was one of the things that really impressed me when I got here, was this cancer wellness center that we have, the Wellness and Treatment Center at the Cancer Institute. And it's really amazing, all the services that they provide. And I know my patients have gotten significant benefit, you know, from doing acupuncture, from seeing a nutritionist. So that's part of the team also, you know, as we were talking about with prevention and staying well, you know, it really adds to this team of, you know, great medical professionals, but also the supportive care that we have. We have genetics, you know, that's also an important part of the team. So the team is multiple facets, and we all work really well together.
And doctor, what is the latest in breast cancer treatment options? Most people want to know, does every person need radiation, chemotherapy, surgery? What's happening now?
So, so what's new in breast cancer? I mean, there's so many things that are new in breast cancer. So, you know, it's a huge topic.
Okay.
We're making progress from detection, prevention, all the way up to survivorship, and, you know, every way along the way. So we've made a lot of improvements. I mean, I would say that, you know, we're doing more molecular profiling and identifying, you know, which patients need chemotherapy now more than ever. I think we've identified patients that benefit more from neoadjuvant or treatments prior to surgery. And we have improved upon the targeted therapies that we're using. And that's really a fantastic approach that, again, in the past, we haven't been able to do. We've been able to conserve breast tissue, where in the past, we haven't been able to do that as much. And also treat the patient systemically earlier rather than later. And excuse me, we've really made a lot of progress in that regard. So there's many different ways that we've made progress. In terms of your second question, who needs chemo? It's really on a case-by-case basis. So as an oncologist, I typically will meet with the patient either before or after surgery to discuss this. And the things that go into our decision, of course, you know, the patient is the center of the team, right? So the patient oftentimes will have an opinion on what they want to do. It's my job to educate them. And certain factors play into a decision, you know, how healthy the patient is, how likely they are to tolerate some treatments. And in terms of the need for surgery, a majority of patients do need surgery when they're diagnosed. There are some rare cases that they don't need surgery. For example, if the cancer has already spread to other parts of the body, most of the literature would support not doing surgery initially. But most patients do need surgery. And in terms of other treatments, you know, such as chemotherapy, targeted therapies, it's a very complicated discussion. But we are making progress in identifying who really needs what specific type of therapy. So for example, you know, if a woman has a triple negative breast cancer, a majority of those patients do need chemotherapy. If a woman has a HER2 positive breast cancer, a majority of those patients will receive chemotherapy and anti-HER2 therapy. And for estrogen positive patients, most of them will benefit from getting an anti-estrogen, but we're getting better at identifying which of those patients actually need chemotherapy by doing molecular profiling. So more and more, we're using more targeted approach, less toxic approaches with regards to medical oncology. We've made a lot of progress in that regard. In terms of radiation, typically we will refer to a radiation oncologist for that discussion. But again, we all are constantly discussing cases back and forth of, you know, who needs the best treatment, and that does improve outcomes for the patients and it reduces stress. So.
Well, it's the good thing is, doctors, it sounds like it's more and more a customized approach with a lot of support, as opposed to, frankly, one size fits all breast cancer, which it was 30 or 40 years ago.
Exactly.
It's much better. It's much better. Well, thank you both. For both of you, and alluding earlier to your comment about the mind-body connection and stress, Dr. Chatterjee and Dr. Schaefer-Cotillo, what do you do to help patients cope with the stress of getting the breast cancer diagnosis and treatment process? Dr. Chatterjee, I'll ask you first.
Sure. So that's something we take into account first time we meet a patient who's newly diagnosed. We have some work lists that we have to identify which patients are at more stress than others. And we introduce them to our integrative medicine program, which is complementary to patients, which is a huge support tool for patients. So it's something the patients love and you'll hear more about, and that helps them as well. And just to add to what Dr. Cotillo said, included in our breast tumor board discussions, we also look at which patients meet criteria for clinical trials. And through Northwell, we're increasing our breadth of involvement with clinical trials. So that's also something that's been fantastic with Northwell.
Do you want to add to that, Dr. Cotillo?
Sure. So, I mean, I think, you know, from the moment you walk in here, I think the patients feel supported. And, you know, we have, as I mentioned, this whole team approach, which really supports the patient. We have the Cancer Wellness Center that supports the patient, but just the staff. I mean, everyone, from the person who draws your blood to the person who gives you your chemo, to the nurse that helps you after your surgery. I mean, just every step of the way, the patients are getting supported. And we have navigation, which the navigation is really helpful. It really reduces the stress. It's fantastic. And then we also now, I just want to bring this up because it didn't come up before, but we also have a technology of reducing hair loss for women going through chemo. And I think this has been huge. And for me, I'm just thrilled that we have it here. At my prior institution, we didn't have it. So I'm just so thrilled that we have it. And again, it's right in your backyard. It's fantastic. So the way it works is that if a woman's going to get chemotherapy, we can sign them up for what's called DigniCap. And they get essentially a frozen hat that sits on them while they're doing chemotherapy, and their hair loss is dramatically less. And for something that causes so much stress and so much anxiety and sadness, frankly, we can help alleviate some of that stress. So it's really been wonderful to be able to use this technology, and I'm so thrilled that we have it. And I think it is part of the, you know, sort of supporting the patients and helping them through this difficult time.
If you're just joining us now, you can see that on the left-hand side, at least of my computer, maybe your phone, You'll see a pink panel, schedule your mammogram today. This is a special panel discussion on breast cancer health and options available to you, being brought to you by Northern Westchester Hospital. And you can see nwhgetyourmammo.org or call 914-666-1625. They're also open on Saturdays. And you should know that Northern Westchester Hospital provides high quality care close to your home. You don't have to travel to New York City. Part of the Northwell Health family, Northern Westchester Hospital has access to leading cancer centers, clinical trials, technology. And if for any reason you require expertise that is not able to be provided right at Northern Westchester Hospital, you will get referred to expert clinicians within the extensive Northwell family. We're going to move on to a couple of other wonderful healthcare providers that are part of the mind-body connection that we all know is so essential to good health. I want to introduce you to Pat Talio, who has a lot of initials. Miss Pat, you've got a lot of initials next to your name: MS, RD, CDN, CES. That's a lot. And you're a registered dietitian and the outpatient nutrition program coordinator. And you're sitting next to Vanessa McKay-Barr, who is a licensed acupuncturist, also with some initials next to your name. Hello, good morning, ladies. Good morning. I keep saying good morning. I don't know what's wrong with me. Good afternoon. We're in the afternoon. Vanessa and Pat are both part of Northern Westchester Hospital's Bruce and Andrea Yablon Cancer Health and Wellness Program. It's really outstanding. If you or a loved one has been diagnosed with cancer, the Bruce and Andrea Yablon Cancer Health and Wellness Program offers a personalized support plan to complement your medical treatment. Patients of Northern Westchester Hospital doctors have access to these health and wellness services at no charge. And that's quite extraordinary and quite unusual. A dedicated nurse practitioner will work with you and your caregivers to coordinate the following wellness services, which include things like Reiki, aromatherapy, guided imagery, reflexology, the kinds of things that you don't typically have at a hospital, fitness and exercise plans, mindful wellness and emotional support, pastoral care, nutrition counseling, acupuncture, and oncology medical massage. So it's really quite a spectrum. So let me begin with you, Vanessa McKay-Barr. Hello.
Hi, Lisa.
Hi. So tell us, for those of us who don't know, and I confess, I am a regular at acupuncture, but tell the people who don't know, what is acupuncture and what are the benefits of acupuncture?
Sure. So acupuncture is the application of fine sterile needles at specific acupuncture points on channels or pathways that carry energy. And anytime you have an ailment or a symptom, there is an energy blockage in the body. So the acupuncture is essentially restoring function of the energy flow, which then has an effect on your parasympathetic nervous system. This allows more of a rest and digest function of your nervous system as opposed to the fight or flight nervous system. So healing is done during rest and digest mode.
Okay. And now that we're in COVID, acupuncture being such a practice that requires touch, how are you doing it in this time of COVID?
So the health and wellness program is following all of the hospital guidelines. And the hospital follows all CDC guidelines. We are wearing protective eyewear and masks. Everyone's temperature is being taken upon arrival. Same as the hospital admission, same as in the outpatient. So all of the steps and measures are being taken. Patients are being spaced out, so there's room for the time for the room to air out, and your safety is of our utmost importance.
And what role does acupuncture play in terms of treating breast cancer?
So it really depends and varies at what stage of your treatment you're in. So post-diagnosis, but pre-treatment, we're dealing with a lot of stress and anxiety. We're dealing with any comorbidities that might prevent you from starting your treatment, such as Let's say you have an issue with smoking. We can help with stopping to smoke. We can help with reducing your blood pressure if that's inhibiting you from starting your procedures. Then when you're in active treatment, we're looking to reduce any side effects that are occurring from your treatment. So that could range anywhere from nausea, vomiting, to neuropathy, to pain, trouble sleeping, etc. Then following your treatment, there's any lingering side effects that can be taken care of with acupuncture, specifically neuropathy and joint pain, and cancer-related fatigue is one of the most important things that we see too. So it really depends on which stage of your treatment that you're in and how we tailor your treatment to that.
How many, I mean, is there an average of how many acupuncture sessions you might need, you know, in the process of healing from breast cancer?
It really depends on where you are. Typically, in any acupuncture treatment, the longer you've had a symptom, the more treatment that you will need for acupuncture. As a natural therapy, nothing will go away in one treatment, but most people feel generally relaxed and at ease within one treatment. So the beauty of our program is that we do have a comprehensive program where you can try all of these therapies and they work well together to reduce your symptoms and your side effects.
I'm just going to ask the question that everybody wants to know who's never had acupuncture.
I know what it is.
Do the needles hurt? That's what everybody wants to know.
Yes. So it's really the sensation of the needles varies for each patient. So generally, most patients do not feel much. Occasionally, closer to your fingertips or your toes, you might feel a pinch or a prick, but it's really a gentle and relaxing treatment. And I have to say, 90% of the patients fall asleep with the needles in. So it's really a relaxing environment, and I really do my best to make it as painless as possible.
Thank you, Pat. I love it. It saved my life. So I love acupuncture. Really, I do. All right, so now let's go. Sorry, that's Vanessa. Pardon me, that's Vanessa. Let's go to Pat now. So Pat, you're our nutritionist. Hello.
Yeah.
Good afternoon.
Hi.
So tell us about what a big word nutrition is, right? I mean, you talk about changing people's habits and how impossible it is. It's almost impossible to change what people eat. But if you have had a breast cancer diagnosis and people come to you and they say, what can you tell me about what I'm eating that is going to help me heal better? What are you going to tell them?
Well, basically, as similar to what Vanessa was saying, it really depends on where a person is at. If they are newly diagnosed with a breast cancer diagnosis and they're anticipating treatment, nutrition can have a huge impact. What we try to do is we try to maintain good nutrition during treatment, preserve good nutrition, preserve muscle mass. So if somebody is newly diagnosed with a breast cancer diagnosis, what I warn people of is everyone's a nutritionist because everyone eats. Google is our friend sometimes, but can also be our foe at times. So if you're reading things on the internet that is promising things that you really, in your heart of hearts, know sounds kind of outlandish, think about it. Be skeptical. If you're reading things that tell you you need to profoundly change your diet, again, think about it. With focused nutritional care, what we do during treatment is we try to alleviate and reduce some of the side effects that may occur during treatment. So basically, during treatment, what we try to do is get you from diagnosis to the end of treatment without needing a break in treatment, if at all possible. So what that means is we look at people's hydration. How much fluid are you drinking? Basic stuff. Are you eating well? Basically, what we try to do is help people maintain a calorie level where they're not going to start to lose weight, start to lose muscle mass, start to feel tired, and we focus on calories, protein, fluid primarily. The other piece of all of this is if you are starting treatment, we want to make sure what you're eating is safe. Basically what that means is if you have a dear friend, neighbor that brings over a beautiful casserole, that's wonderful. But what I would suggest is that you heat things up properly so that it is safe for you to eat. The other piece too is when you're going through cancer treatment or with a diagnosis of cancer, a lot of times people say, okay, this is the time I'm going to start drinking those green drinks that everybody's been talking about. And honestly, this is not the time to start drinking those green drinks. And the reason for that is because all your green, beautiful, orange, red vegetables are filled with antioxidants. And if you start juicing all of these wonderful vegetables during cancer treatment, you're actually then drinking a concentrated form of antioxidants. At any other time, it's perfect. But during cancer treatment, it's not appropriate because it can possibly underscore treatments that you're going through. So that's another big question that I get a lot of times. And a lot of times it's not even the patient. It could be a family member saying, drink those green drinks, you know, you're going through cancer treatment. Another couple of tips that I talk about is when you're going through cancer treatment, if there is some GI issues or if there is appetite issues, try to avoid long gaps. It's very difficult to talk to someone that
Avoid what?
Avoid long gaps without eating.
The
Yeah.
interrupted, the intermittent fasting, is that what you would recommend?
No, I would say not to. What I'm saying is avoid long gaps. So
Yeah.
try to eat more frequently,
Okay.
especially if you're going through a cancer treatment and your appetite isn't where it normally is, because you want to not only preserve muscle mass and strength and energy, you want to preserve your appetite. So if you go a long period of time without eating just because you're really not feeling well, it's going to be hard to restart to eat. So that's something that we try to help people with going through treatment. I mean, it's easy for me to say it. I'm not going through it. So what I try to do is I try to be as creative as I can with people to come up with ideas of things that they may be able to tolerate and may be able to eat. I try to get people to avoid the weight loss trap, meaning if you're going through treatment, I hear this a lot, especially from women. They say, well, you know, I needed to lose that 10 to 20 pounds, so this may be the time to do it. This is not the time to do it. What I want you to try to do, and what I try to stress with my patients, is that they get from point A to the end of treatment really the same way. Bring in your support. Bring in your family members, neighbors, friends, and ask for the help. Ask for them to make you, a big pot of chicken soup or fish stew. Right now, it may not feel like the best thing for you to have, but if you receive this wonderful, pot of soup, freeze it into small portions so that on the days that you need something nourishing, you could pop it in the microwave and warm it up.
Pat, can I ask you something? Can
Sure.
I ask you? You alluded earlier to not wanting to overload your body with antioxidants. Can you expand or can you explain what you mean by that? How is that counterproductive to treatment for cancer?
It's counterproductive during cancer treatment because if you think about it, what do antioxidants do?
I don't know.
Antioxidants rebuild and regrow. The makeup of them is to revitalize cells, right?
Okay.
And cancer treatment is supposed to be helping you get rid of cancer cells. So if you're overloading your system with something that's rejuvenating,
I see.
it may be counterproductive. There isn't a whole lot of research in that area, but when you look at the science, it makes a whole lot of sense not to be taking something in that is doing basically the opposite of what cancer treatment is doing.
Where do you stand on sugar, Pat? Because, you know, sugar is not considered, I'm talking about, yeah, well, just sugar in general. Where do you stand on sugar during cancer treatment?
During cancer, so I'm kind of going off script a little bit, but just to give you my feelings, I basically think of the process or the role of nutrition during cancer treatment in 3 phases. I think of nutrition, so if somebody comes into my office and is newly diagnosed with breast cancer, a lot of times what they'll say to me is, I wonder what I did, how I ate, or this is the way I ate prior to this diagnosis. Do you think that's the reason why I have this cancer diagnosis? Honestly, we don't know, right? So what I say to them is, think of it in 3 phases. What you did before your cancer diagnosis, what you do during cancer treatment to get from this point now to the end of treatment. So if that means going to, you know, Haagen-Dazs and getting an ice cream milkshake, if that's what you could get down to maintain that muscle mass and the calories, that's what you're going to do. And then the 3rd phase is survivorship. 3rd phase means let's now take a look at your diet. Let's take a look at your phytochemical or your plants in your diet, and is your phytochemical palette varied? Are you eating the color of the rainbow? So at that time, I would say fruit is sugar, right?
Yes.
All carbohydrate basically breaks down to form glucose, which is sugar in your blood. Your cells need sugar. So when you think in terms of that, it's not necessarily sugar. It's making your diet the best that it can be to recover and then to hopefully prevent other diseases. Because let's face it, breast cancer survivors live a long time, and them, just like someone that had a heart attack, now will start to think long term. How can I really make a difference in my diet so I'm not now thinking about diabetes or heart disease?
Thank you. Thank you very much.
You're welcome.
Our next presenter is Nikki Reno, MFA, MPAS, PAC. Nikki is the clinical coordinator for the Cancer Services Program of the Hudson Valley. She oversees the breast, cervical, and colorectal screenings for underserved patients in 7 New York counties. So, Nikki, hello, welcome. Hi. Can you tell us, what is the Cancer Services Program?
Yeah, thanks for the question, Lisa. I'm happy to talk about what I think is New York State's best kept secret that isn't supposed to be a secret at all. CSP, or the Cancer Services Program. It's a program within the New York State Department of Health that covers the cost of breast, cervical, and colorectal screening for people in our state who don't have health insurance or who have such a high deductible they can't afford to go and get screenings, or copays that are just too much for them to afford. And then we partner with folks in the community, and we provide the coverage or the payments for these services so that they're able to get them.
It's wonderful. And how, I guess what I want to ask is, how can people find you?
Well, so we have tons of partners in every community, one of which is obviously Northern Westchester Hospital. So for example, if you know you need a screening mammogram and you know that you don't have health insurance or concerned about the cost of that,
Right.
We have people at Northern Westchester Hospital that will contact us. You let them know that you're concerned about the payment, you don't have insurance, and they know to contact us.
I see.
And that's how we find, the patients. There's also a hotline people can call, but actually it's great for them to go to their provider, and then we hook them up. We call the patient, we speak with them, we see if they're eligible. If they are, we hook them up with a care coordinator that will help them schedule the appointment, will help with translation if that's needed. We'll help with transportation costs, all that stuff to help get them to that appointment and that screening, and then walk with them through, you know, their healthcare journey, wherever that may lead. So if for, you know, unfortunately, so a lot of times these screening mammograms, they show something abnormal, we continue to stay with them and we cover the cost of all of the diagnostic services that they may need up until the point of a diagnosis. And hopefully they're not diagnosed with cancer, but if they are, we then connect them with the state's Medicaid cancer treatment program, which will help cover the cost of their cancer treatment. So we're in it with them for the long haul. So
Wonderful. Thank you, Nikki. Thank you very much. Our final guest for the panel today is Lynette Waterhouse. Hi, Lynette. You've been waiting patiently.
Hi, Lisa.
Hi.
Don't
You're
worry.
a former Cancer Treatment and Wellness Center patient of Northern Westchester Hospital, and we want to thank you very much for talking about yourself and being willing to share your experience.
You're welcome.
So, well, let me ask you this. We had COVID back in March. What was your experience like then when COVID hit as a breast cancer patient?
Well, it was interesting because my treatments had started before COVID actually hit. And when it did hit, I know a lot of people get stomach knots, but I found that the hospital was very caring, taking a lot of the precautions that were necessary at the time. Everything was well sanitized. And everyone from the doctors to the nurses to all of the departments made us feel very safe, so that we had, or I had, no trepidation in terms of continuing the treatments. And every day I have to give them credit. They came in no matter what to make sure that we were safe and taken care of.
So there was no delay. In other words, your breast cancer treatment did not get postponed because of COVID?
No, not at all. I was undergoing radiation treatments and it continued flawlessly every day.
That's amazing. So for women who are hesitant, who are afraid, you know, during this time to get screened, what would you say?
I would tell them not to be afraid. I know this whole situation is scary, but I think what's even scarier is getting the cancer diagnosis or waiting, even if you feel something that has to be looked at a little bit further. Go and get it done. Getting a mammogram, getting the ultrasound, MRIs, it's all very safe. Everything, again, all of the precautions are taken to protect the patients, and it's in every woman's best interest. Don't let it go behind. Keep up with it.
You know, Lynette, you look great. Are you
Thank
feeling
you.
as good as you look?
Yeah, yes, God willing, it stays that way.
Yeah, yeah. Cool, as we say. We'll have to spit a lot now.
Yes.
If you're joining us now, I'm Lisa Wexler, and we're part of this wonderful panel sponsored by Northern Westchester Hospital, where we really are encouraging you. It's very important to take care of yourself and your breast health. Schedule your mammogram today. Don't wait. You can see on the top left, nwhgetyourmammo.org, easy website, or call 914-666-1625. They're even open on Saturdays. I want to just ask a couple of questions. I think these are directed to Drs. Chatterjee and Schaefer-Cotillo. And then we're going to thank you for joining us. We're only here for another 10 minutes or so. I have questions for you. Ready, doctors?
Ready.
Ready?
Does breast augmentation increase my risk of breast cancer? And does breast reduction reduce my risk of breast cancer?
It's a great question. We get it a lot. So no to both.
Oh, okay.
There is a rare form of lymphoma that was recently out to have been associated with a certain type of breast implant. So patients that have that particular type of breast implant, their plastic surgeons are notifying them, or they could contact their plastic surgeon to ask if it's a textured silicone implant. And then they could see a breast surgeon. But overall, breast augmentation does not increase the risk of a woman's breast cancer risk. And breast reduction at Northern Westchester, we do label and analyze all the breast that is removed during the reduction. That's not a standard, but that's something we implemented because we were finding a lot of incidental cancers in breast reduction. We have a large volume of plastic surgeons that work here. So we were finding that, so we implemented that change a few years ago. So we analyze what's removed, but that doesn't really decrease your risk of breast cancer because the breast you have still maintains its original risk.
I see. So if, I mean, I'm just thinking intuitively myself, if you have a lot and you take away some, it doesn't mean that you reduce your risk of getting it in the rest, huh? No.
Correct, right, doesn't work like that.
Okay. What about genetic testing? Who should get it and what do you recommend?
So that's also a gray zone constantly being changed. There are certain requirements of the NCCN that the insurance companies follow when they decide which patients they're covering genetic testing for. But because of 23andMe and Ancestry.com, genetic testing is becoming a little more prevalent. So those companies are not using CLIA approved genetic tests, but they are kind of giving patients genetic testing results. So if you have gotten that, please see a breast surgeon or one of your doctors so you can have confirmatory genetic testing through an approved genetic lab. And you can have that discussion, but basically anyone who wants to have genetic testing can have it for $250 or somewhere ranges from $0 to $250. And they can, you know, go forth with getting the genetic testing because it's becoming way more available to patients because of the commercial labs. So you want to go to a specific approved lab, which is the CLIA lab, which are specific. They go through rigorous quality control of making sure that they're providing accurate data to the patient.
Pat and Vanessa, question for you. Are health and wellness services happening right now to be able to book appointments?
Yes, health and wellness has been open since August 3rd, so we are available Monday through Friday. And you can, if you're interested in any services, you can send your name and your phone number in the chat and we can follow up with you.
Well, that's really nice. And what's also the basic telephone number?
914 242 8146.
Thank you. 914-242-8146. Thank you very much. Again, question for the doctors. Doctors, what causes breast cysts? And what are they, by the way?
So breast cysts are basically fluid-filled sacs in the breast.
Okay.
Oftentimes, caffeine and hormones can make them grow. Some patients are just more of a genetic predetermination to getting cysts, but typically right before your cycle, you can have increased breast cysts, and caffeine and hormones increase that. So chocolate, soda, coffee, tea are some of the main contenders there.
Yeah, it's really impossible, isn't it? I mean, you know, we're told we can have a little bit of chocolate every day and it's good for us.
Just like everything in moderation, yep. Try to stay in the middle of the road, and that's kind of the best bet we have.
Absolutely. I'm going to go back to Pat and Vanessa. Question, are any of your services complimentary?
All of our services are complimentary because of our program, Bruce and Andrea Yablon Cancer Health and Wellness Program. They provide all of these services for patients that have a cancer diagnosis.
And if you don't have a cancer diagnosis, are you open to the general population within Northern Westchester that may use the hospital for something other than cancer?
We also have a fee-for-service program that patients are entitled to join. They can call the same number, the 914-242-8146, and they have access to all of the same physicians for complementary medicine, integrative medicine.
Okay, thank you. All right, let me, a question, doctors, about breast thermography. How effective is it as a screening method? Could you please explain what it is? And then tell us how effective it is.
So breast thermography has been out for a few years it was kind of pitched as an alternative to mammograms and avoiding the risk of radiation from mammogram. However, it's not been validated in trials. So it's not a standard metric for looking at the breast. And unfortunately, these places are out of pocket expense and they'll tell you to come every 3 months for $200 to $300. But the data that you're getting from that isn't really usable for us clinically. So if there's an abnormality detected, you will be, sent for a mammogram and an ultrasound and things that we can actually follow with our guidelines. So, people are open to use it. It's sort of like you can use it, but there's not much we can do with the information you get from it.
So it sounds to me, doctor, like if you're going to take your time to go get a screening for breast cancer, you want your mammography. That's what I'm hearing.
That's the number one thing to do. Yeah.
That's number one. You still like that the best. And sonograms, I know, are also complementary to mammograms for dense breasts, but for you, it's still the mammogram, no matter what.
Correct. With dense breast, you should do mammogram and ultrasound. And then if you're high risk, we can talk about the MRI. But mammogram is the number one.
Number one. Okay.
All
right. Let me see. And this, I guess, is a question. I guess it could be addressed to all of the panelists, but let me start with the doctors. As a survivor, we learned that our bodies cannot be how it was before surgery and treatment. Do you have any recommendations for survivorship and lifestyle changes?
So we have a survivorship program here, which really helps with adjusting to sort of the new normal. And in terms of oncoplastics and surgical outcomes, we are really sensitive to how women feel at the end of their surgical treatment, and we care about that. So that is a conversation that happens between all of us, and it's something that's very important that goes into the planning and the decision-making of incisions and what type of reconstruction. So that's something that we take very seriously from day one, the first meeting, and that continues. And then we have our survivorship program, which is offered to patients throughout their journey and helps with adjusting to kind of the new normal with all of the changes, even from after chemotherapy, after radiation, being on endocrine therapy, and the side effects that people might be feeling. So those are also available with the survivorship group.
Yeah. I mean, very often for people, a cancer diagnosis is a chance to look at all their choices, right?
Yeah.
It's just one of, right, Lynette? I mean, you just.
Yes, it is. It makes you reorganize your life.
Exactly. And that's well put. That's well put. Well, I want to thank all of you for joining us today and thank those of you who are watching and listening. We have a survey that we're asking you to complete. It will pop up on your screen. We really care about your feedback. We want to hear from you. If you would like to be contacted to answer personal questions or schedule an appointment, please share your name and phone number. One of the patient navigators will contact you. And remember, it's October, it's Breast Cancer Month, but that doesn't mean the other months of the year are not a time to take care of ourselves. So please schedule your mammogram today. It's nwhgetyourmammo.org or call 914-666-1625. And something that, has been pretty obvious, but we haven't really put a fine point on is that if you're a patient at Northern Westchester Hospital and you want to, you can choose to be exclusively treated by women if you want to, because we have women at the highest professional echelons of their professions. And so there's no compromise whatsoever at all. But some people feel more comfortable, women, with women. And so you've got this outstanding staff of women at Northern Westchester Hospital, which for a lot of people is also a plus. So thank you very much for joining us today. Thank you to all of you. And once again, don't forget to take care of yourself. nwhgetyourmammo.org or 914-666-1625.
Thank you.
Thank you.
Thank you.